Hi, everyone. Sorry I was a bit late. I just ran back in from the Capitol. It's very cold here in Tallahassee, as you can imagine. For a Floridian, cold for us means something different. But it's so great to share space with you, and thank you for that kind introduction as well. I want to just speak briefly about this legislative session. Of course, set the tone that in Florida, we are constantly playing defense on a lot of healthcare access issues. Stefan mentioned just the attacks on the LGBTQ plus community. So I'm going to take a few minutes to kind of set the stage a little bit for what we're working on in Florida. And then, of course, I want to open up for questions and hear what's top of mind for you. And before I do any of that, I just want you all to know how important this issue is to me. Many folks know my personal story already, but my mom actually was diagnosed with cancer when I was about 9 years old. And after 4 years of fighting, passed away when I was just 13. In fact, January 24th of this month of this year will be 20 years since my mom passed away. And that is something that I always think about every single day, and just how hard she fought, but also how our family really struggled to access the best care for her, and the amount of debt that my family carried after she passed away. And I just don't think families should have to make a decision between accessing a medication or a doctor's appointment or preventative care, mental health resources, versus can I pay rent this month? Can I put food on the table? And unfortunately, money in politics has really corrupted our systems. And whether it's the power of big hospitals or pharmaceutical companies or insurance companies, of course, we're constantly having to push against these special interests to do what's right for our communities. And I'm proud to say that not only do I not take money from these institutions, but I actually reject money. In fact, insurance company offered to donate to my campaign, and I said no thank you. And I do think we need more elected officials and candidates who are willing to put that flag in the ground and to say, I'm not going to run a campaign that's fueled by these special interests. I'm going to run a campaign that is fueled by my community. Of course, that's not easy. When I compare my fundraising to other colleagues, I'll raise $20,000 in a month from hundreds of donations, and other candidates have $21,000 checks that are handed to them, right? They don't even have to ask. It's just like handed to them. So I would be, I would be understating the amount of stress that I have every single day in my work as a policymaker in Florida, but also just as someone who is constantly trying to do the right thing and still pay the bills on time, right? So I do appreciate, again, just everything y'all do in helping to amplify the importance of these issues and challenging corporate greed along the way. So let's just talk briefly about this legislative session. So healthcare actually is a priority of the Florida Senate, but as was already noted, Medicaid expansion continues to be ignored. And of course, a single payer system is just completely rejected by this majority party in Florida. I will say, though, that I think as Democrats who've championed issues like Medicaid expansion, we are putting Republicans on defense in the sense that they are having to respond to the media about this issue, constantly trying to say why they won't expand Medicaid while we hold the charge of the importance of doing so. And we are seeing some bipartisan support. In fact, one freshman Republican who's a doctor from the Panhandle does support Medicaid expansion. So we are seeing, some efforts across the aisle, but just not enough to actually see movement. And as you might have seen, Governor Ron DeSantis, who is barely even here because he's losing in places like Iowa, he has time and time again rejected federal dollars and federal programs for different initiatives and issues. So we are not dealing with good faith leaders. Now, I mentioned the Senate prioritization. I'm going to drop just an article in the chat, for folks to have a reference. So the Florida Senate is pursuing a healthcare package. I think the chat's closed, so I'll do it when the chat reopens. But this is Senate Bill 7016. So this is really focused on workforce. So they're trying to help expand access to healthcare by strengthening the workforce pipeline, which I will say is necessary in Florida. But of course, if you don't have insurance or money, you can't see those providers, but we do have a provider shortage right now, especially when it comes to nurse practitioners. So this is a bill that's trying to provide dollars to expand medical residency programs and to try to retain new doctors who might study in Florida, but then leave Florida. Now, why would they leave Florida? Well, first of all, a lot of our doctors can't even provide the type of care that they want to provide. We have a state that has demonized vaccines. We have a state that, of course, has banned abortion at 6 weeks and is also attacking the LGBTQ plus community. We do have more policies filed targeting the transgender community in particular. The intersections with healthcare include banning insurance coverage for gender affirming care, requiring insurance coverage for so-called conversion therapy, which many of you might already know. It's not real therapy. It's basically a myth, an attempt to pray the gay away. They want insurance companies to provide coverage for that. So we are seeing a lot of regressive healthcare policies in the state of Florida. To that same point, we do have bills that are trying to champion more access to mental health resources. I have filed legislation to decriminalize self-managed abortion. If someone were to end their own pregnancy, we don't want them criminalized for that. So I filed legislation to provide that clarity in statute, as it is not very clear today in Florida. And on top of that, we also do see policies trying to set caps on things like insulin, and other efforts around health insurance programming. So, for example, legislation that would allow associations, for example, the Farm Bureau of Florida, to provide their own health insurance group plan to try to reduce the cost for their members. So we do see some creative plans like that being pursued by, I would say, unlikely proponents, right? But I think the reality is that a lot of different business interests cannot afford insurance right now. So they're trying to get creative, with their members, which, they'll even admit this is not an insurance plan that you can take to the hospital with you because it will be too expensive, but you can access preventative care. So even these private sector actors who are trying to figure out how can our membership have access to healthcare realize that the solutions they have are really not good enough. So with that said, I will step back. There's so much more I could talk about, but I want to be sensitive to everyone's questions and what's top of mind. But just thank you so much again for the opportunity to share space and to kind of give you a quick insider perspective of what's happening in Tallahassee. We really just started legislative session. It's only 2 weeks in, so a lot to come. Our legislative session is 60 days in totality, so we are literally in the beginning moments.
Yes, hi, Representative Eskamani.
Hey,
and thank you so much for everything that you do to represent the people. I know that you have signed a pledge that the National Nurses Union has asked candidates to sign to put people over profits, basically, and to take the to not accept over $250 from any. Let's see if I can read it here. I have. Oh no, it's 200. It says from executives, lobbyists, or PACs affiliated with hospital, insurance, and pharma companies that have chosen to bankroll an effort to halt any attempts at healthcare reforms. And I thank you so much for signing that. I don't know if we've had other people in the area or in Florida who have signed it. Maybe you do, or maybe Stefan does. But I'd like to know what inspired you to sign the pledge, and if you have ideas about how we might get some other candidates and officials to also sign the pledge.
I love that question, Terry. Thank you. And thanks for all your work in the Tom Keene race as well. A big win in Florida for sure. So I check my email. So that's step one. Like I try to keep in touch with my own email. So I actually saw the pledge come in, I think, to our campaign website. And it was really easy for me to sign because I just don't take that money, right? And it's so interesting for me because it kind of goes two ways. Like, most of these companies don't offer me money either. I mentioned that one insurance company, had offered me a check, and it was easy for me to say no because I just don't feel comfortable, taking that kind of money. But it is very, it can be very challenging, because we do have to work with these companies as constituent services. I'll give you an example. So I hosted a series of constituent services at the Orange County Public Library System. So one of the sessions we hosted was at the downtown library, and we met a family of four. And the mom and the dad have been dealing with their health insurance not providing coverage for a medication that's been prescribed to them. So I was like, yeah, absolutely. We'll definitely help with that. So the first steps we usually take in that situation is I basically play mama bear to the insurance company. So I contact the insurance company's like legislative liaisons, i.e. their lobbyists. And usually when they get an email from a rep, they get nervous, right? Because they don't want this issue to get to a bigger level of problem, which like I will do if I don't get an answer. And so oftentimes we're able to get them to respond. And in this case, it was like weeks of back and forth with the insurance company. And this family finally got the coverage that was rightfully theirs. In those situations, I think a lot of politicians assume that in order to get that kind of response from an insurance company, they have to have, quote, a relationship, right? Or a friendship or some sort of like inside connection. And the reality is just the positional authority I have with the title of representative really is enough to get a response back. I don't have to know these individuals. I don't have to take their money. I don't have to have a friendship. We're professionals, right? I would say that we're colleagues in the process. I'm not going to be, like rude to you, but I'm also not going to like take your money. And it's really that simple. And I think for a lot of politicians, it's like relearning how things are done, right? Because I think the assumption is that you're not going to get that kind of response. It's the same thing with Duke Energy. Like we have to deal with Duke Energy all the time because we have Duke customers in my district. I don't take a penny from Duke, but if I need Duke for something because they've overcharged a constituent or a constituent's behind on payments, and I need to see what Duke can do to help them, they will always be responsive to me, and they're not going to do that once I'm no longer elected, right? But as long as I have this position, like I can leverage it to help people without sacrificing my values. So I think a part of it is teaching lawmakers that. And I try hard, to be that positive role model influence to my colleagues, but it's just hard because people get wrapped up into like the perception of power, and they think that, they've earned that check, or they deserve that check. And I would argue that it's just transactional. You didn't even earn it. You know what I mean? They just give it to you because the assumption is that if they give it to you, you'll vote good on their issues, right? They're proactively trying to protect themselves in that way. And so, with that said, I think the best way to help more candidates not fall into these traps, not fall into these in the status quo, is one, to get to them early about these issues. Like I signed, for example, the Sunrise Pledge, my very first campaign. And again, it was just kind of a no-brainer. Somebody asked me like, hey, will you sign this pledge, not take any fossil fuel money? And I was like, sure, like I'm not going to give it to me and I'm not going to ask them. So it was just kind of a good fit for me. And then once you do one, it's easy to keep going. You know what I mean? Like once you put your toe in the water, it's like, oh, that wasn't too bad. I don't have to take the tobacco money either. And I don't have to take this money either. And before you know it, you're running a campaign that's very, very much, people driven versus transactional donors. So I think a part of it is approaching candidates early. And honestly, you have to support those candidates in different ways. Like I can only really say no because I work hard to raise money from different places. And that is very time consuming. So to also host a house party for a candidate you care about, try to help them raise funds from small dollars, because we do have to, at the end of the day, campaigns are expensive. My very first campaign was in totality about $800,000. And that's a state house race. I mean, it's crazy, but that's literally what it cost me, right? And I raise about the same every year to maintain our seat in the Florida House. So that's the challenge, is we also have to make up, you don't have to make up 100% of the difference, right? But you still have to find a way to compensate for the money that won't be there from transactional donors, which is why, by the way, so many of these companies, they do prey on like members who represent communities of concentrated disadvantage because there isn't as much money in those districts. Like I also feel really lucky because I have a swing seat, but it's a seat that has a lot of economic diversity. So I have folks in the district who have the resources to host an event for me, right? Some of our other colleagues, they don't have districts like that. So we have to help our colleagues raise funds in other districts in case their district doesn't have those resources. So they're not going to take the AMSCOT money or the Humana money or the United money, right? So that's part of the dichotomy too we have to figure out.
Hi, Rep. Eskamani. Thank you for taking the time to be here to speak with us tonight. I wanted to ask if you've had the opportunity to review the federal Medicare for All bill, and if so, if that's something that you support.
That's a really great question. I don't know if there's been any new versions recently filed. Honestly, it's because I'm in the the state legislature, so I focus more on state. But I have read previous iterations of it, and I have signed pledges to support it. And so absolutely.
I'm a physician. And I live in Gainesville. One of the questions that I really have is, the area around here, North Central Florida, is a place that's kind of a desert for a lot of hospitals. Obviously not
Right.
Gainesville itself, but I have not, I've looked at the Live Healthy bill, and like you said, it's mostly about workforce. So it's not really going to solve that problem. But I also don't see any of the Republicans in the North Central Florida area taking on this as an issue. What do you think will move them in the direction of being able to step up more?
That's a great question. So my first reaction is that, the solution a lot of my colleagues pursue when we're talking about healthcare deserts is always scope of practice. Like that is their go-to answer is, oh, well, we just need to, expand the scope and allow nurses to do XYZ or, open up, the space for different types of doctors or different types of things. And honestly, it becomes a big food fight in the legislature because it often different stakeholders just fighting with each other, debating on what they can and cannot do in their profession. And I really don't think that even solves the healthcare deserts. Because at the end of the day, you have to incentivize people to work in some of these rural areas, especially younger doctors. They might not feel like there's an environment, a community for them, right? They might want to be in a more urban setting, more urban environment. So I think a part of it also has to be incentivizing those new doctors or established doctors to want to build their presence in more rural communities. And part of that could also be, medical school debt incentives, like to help cancel their debt if they are committed to working in an area of need. But to your point of getting more lawmakers involved, I think a part of it is storytelling. It's helping those lawmakers that represent more rural areas to see the need, to understand the need. These are individuals who've never really struggled to access healthcare. So unless we can tell them and show them, hey, these are the disparities that we're experiencing in our communities, I don't know how much they're going to actually care. I have found in the legislature that most of my Republican colleagues don't care about something until they are directly impacted. Like it is just a legislature that lacks so much empathy that until they are in the crossfires of something, that is when they actually step up to help. The last point I made to this question, this really great question, is just thinking about, the advancements of telehealth, the need for public transportation alongside, greater just coverage support. And I think part of this infrastructure, there's just so many missing pieces. And when you have a Department of Health that doesn't even want us to talk about racial disparities or the social determinants of health, then we are regressing in our efforts to combat health deserts. So that's also part of the challenge is we have a Department of Health that doesn't even want to talk about disparities and pretend like they don't exist.
Hi, Representative Eskamani. First of all, thank you for every single thing you do. I'm going to gush a little bit about how proud I am to be associated with Central Florida right now because of you and some of the other representatives we've got. Y'all are just awesome. But I was going to ask a very similar question to what the previous person did. So instead, I want to ask you, I know, within, seems like the last year, we threw several 100,000 people off of Medicaid in the state. What actually happened to those people? Do they I mean, are they just basically been left on their own, or is there any hope for them at all?
Yeah, really great question. So we as the Democratic House Caucus has asked, we've made multiple requests for the so-called Medicaid redetermination to stop, like pause it, stop kicking people off the rolls. So we've made that ask more than once, and we'll continue to do so. Of course, those calls have gone nowhere because the department continued on this process. So for individuals that were wrongfully removed because they missed the memo or there was confusion over their status, there is an appeal process. And we do have organizations like Healthy Voices for Florida that is providing resources and support and if necessary, even legal guidance on how to appeal that decision and how to counter what the determination was. With that said, we know that there are going to be thousands of people that don't know they were knocked out. They're not going to find out till they try to make an appointment or bring their child to the doctor and realize that their insurance is no longer eligible. So we have engaged in different PSAs over the past months to educate Floridians on this. I know our team did multiple email blasts, social media postings. We really try hard to communicate this. We actually hosted at least 2 virtual events with Primary Care Access Network to talk about this process and what to expect. And so we are actively trying to educate the community and make sure folks know that you have a path forward. And it won't be an easy one, but we do want to make sure folks know they're not alone once they find out they're in that situation. And this also reminds me too of just things like the APD waitlist, about the waitlist for long-term care for our seniors and those that are living with Alzheimer's and dementia. Florida just has so many backlogs in all these services. There are people that die while waiting for care. And, instead of kicking people off, we should be expanding and getting people enrolled and getting their programs funded. And so it is incredibly frustrating, but I do want you to know that each one of us in the Democratic Caucus have really prioritized, in particular, this issue and trying to do what we can to catch those who have fallen through the cracks.
Thank you.
Absolutely.
Yes.